Hi guys, I think I'm live now. Um, so hi, so this is my webinar. So my name is Anusha Yoganathan, and I'm a second-year medical student at the University of Liverpool. Yeah, I think this is right now. So welcome to my webinar. My webinar today is about the importance of asking questions. And just before I begin, I'd just like to talk about myself a little. So I'm originally from London, but I've moved to Liverpool for medicine, and I've gone to university straight from high school. And yeah, that's pretty much me, but I'm a second-year medical student and we've already started placement, so that's really good. But my topic today about the importance of asking questions, it kind of came from, because I was talking to my friend about something, and then we just both realized how in school what we learn, and it's primarily from how we learn in high school, and it's a lot of like rote learning and not a lot of asking questions. So I don't know, like I just thought I know when I talked to my friends in high school, it was kind of the same thing, and it's kind of like the same in university as well. So we're just talking about how that, how we can better our learning or better our understanding of topics through asking questions. So I guess that's what my talk today is about. It's first of all about the importance of asking questions, what we can learn from it, but also at the end, maybe a few tips on how to become better questioners, if that makes sense. So, so I'd like to start off with a little proverb that I came across, and it's a Chinese proverb, and it goes, "He who asks a question is a fool for 5 minutes, but he who does not ask a question remains a fool forever." And my take on that question is, if you might think it's the stupidest question, you may think it's literally like so obvious to everyone else, so you don't ask it. You have this like burning, I don't know, like you just need to know the answer for that question, but you don't want to ask it because one, you might be in front of a lot of people. Like here in university, my cohort's like 280 people, and our lectures consist of all 280 people. So if I have a question, for example, I don't know, I maybe might not ask it because I think I might look stupid in front of people who do know it. And it kind of was like, it was kind of like that in the beginning of high school, like, because, you don't know anyone and you might not feel comfortable. So you just don't ask the questions. So that's kind of what I started doing in university as well, just because of the amount of people that were there. But if you overcome that, and if you, just get a little bit of courage and make yourself a little comfortable in your environment and ask that question, you never know, like someone else might have had that question, and not only do you help yourself, not only do you better your understanding of the topic, but you've also helped someone else by asking a question. And well, that's my take on the proverb. Like, it's just a few seconds, and even if it was obvious, no one's going to remember that. It's literally, oh, you just asked it in a lecture. So I think that sacrifice is more than enough for the amount of knowledge or understanding that you might gain from it. And through that, I've kind of just learned, like, learning, it's better through asking questions. It's so simple and it's so effective, but I feel like we've forgotten how to ask questions, or we just don't value we don't value questioning as much as we should. As children, you ask everything. You've got these annoying little cousins. Oh, I've got such an annoying little niece, and all she does is ask questions. But I might find it annoying, but for her, it's that curiosity, and it's about me making that environment for her to ask enough questions, and just ask whatever she wants. But we'll go into this later, but like how to ask good questions or when to ask questions. But it's just, as children, like you see children do this so much, but then you look at adults and you're like, well, why have we lost that valuable learning tool? And it's Newton that asked, why did the apple fall from a tree? And Darwin asked, why do the Galapagos Islands have so many species that aren't found anywhere else? And it's these questions that lead to great breakthroughs. And asking questions is still relevant today, you know, as it was like hundreds of years ago. It's still relevant today. And only by asking consistently and constantly can you find better solutions and better products to what you want. But so I want to start talking about it in like high school, because it's just, I feel like it's the way that learning and teaching has become. It's very like memorizing. You just have to memorize it, and it, even if it doesn't make sense, people are just told to just memorize it, like it's spelling or something. And they forget that, like, you know, the foundation of science or of anything, but mainly science, is because that's what I kind of identify with. It's to ask questions about the natural world, about anything, and then you seek answers. And if you learn science like it's a spelling, like you have to memorize something, then you're failing to communicate the reason why that science exists as a discipline and what it has to offer. And sadly, I think that reflects our approach to like learning and teaching science. You know, if you're in a classroom, you know, you're just told, okay, learn this, learn that, don't deviate away. You know, if you ask something off topic, then the teacher might just be like, give you a one worded answer, or be like, oh, we'll talk about it later, or we don't have time for this. And I don't know, for me, that's just it. I think it stops people, because you don't create, like I said before, you don't create that environment of making people curious. Or if they are curious, you know, you don't let them express that. So I think that's one way that we can improve, letting us, creating that environment in order to allow students or even people to ask questions. And like I said before, like young children, they're full of questions. They're spawned by like curiosity rather than trying to impress. Because I feel like in high school, like if you know something, you put your hand up and you say something like, oh wow, like yeah, he knows that, or she knows that, or she's so clever. And it's become more about impressing than it is about learning. And I think that's why in high school or in a teaching environment, asking questions has just kind of slowly died down. But it's about knowing the importance of it and bringing back that that value to asking questions. So I've got a cold and a bit of a cough, that's why my voice is a bit congested. Sorry about that. And I also think it's about like, don't accept it. Don't accept it. If someone tells you to not ask that question, you know, just no, ask the question, or go out and find somewhere else. You know, Google it. Like the internet is like, you know, everyone knows how to use it, hopefully. But just don't accept it when someone says no to you. Like just keep asking why and ask more questions, I guess. And I think not asking good or enough questions has a direct impact on the quality of the choices you make. So like you won't be able to get that deeper insight, or you won't be able to create, like, think of more innovative solutions. And I just think asking questions makes you a better decision maker, and it makes you a brilliant thinker, it makes you a good scientist. You know, we talked about like most breakthroughs in science happen, or in anything happens, just by asking questions. I think I was reading this book, and it was like the guy who invented the Polaroid camera, Edwin Land. He created it because his 3-year-old daughter asked him, why is the camera that we're using, why doesn't it have, like, why can't you just create a photo immediately? And there you go. He thought of to like make a Polaroid camera. And there's so many other like cases in history where this has happened. So why does it have to be in history? You know, why can't we do it now? And it doesn't matter if you're in high school or if I'm in university. Like, questions is the base of learning. It's the base of good learning. And if, well, as a medic, I just thought about, what about asking questions in the hospital or as a patient, you know, because we're taught as medics that when we become doctors and we talk to patients about whatever illness that they might have, you know, when they come into a clinic, we get told you have to ask questions, but ask different types of questions to elicit different types of information. So, for example, when a patient comes in, you're not like, oh, do you have a headache? Do you have this? Do you have that? You ask a broader question like, oh, what brought you into hospital today? Or what brought you into clinic today? So again, that's an example of asking like a different type of question, but then you kind of narrow it down into whatever diagnosis or whatever illness that you might think they have. So like a more close question, like, oh, how many times did this happen? Or what does it look like when it's like this? Or, you know what I mean? Like just different types of questions, open and closed. So that's about asking questions just in a very simple way, not like breakthrough or wow, but like in a simple way of how asking questions can help other people. But because, you know, sometimes I've heard that, like, once I went with my dad to the GP and like she literally didn't let him talk at all. Like she asked a question and then he said one thing and then like she interrupted with what she wanted to say. But again, if you do ask someone a question, like give them the time and space to kind of process it and understand it as well. So now that we've talked about like the importance of asking questions, maybe like have a little chat about how to ask like such effective questions and how do we make a habit out of it. Like, don't make it a one-time thing. Don't be like, okay, after this webinar I'm going to go to my first like lesson and just ask like 100 questions and then not talk at all. Like, how do you make a habit out of it? And one thing I want to start by saying is that it's not something you can just get. Well, I'm no expert to talk about this. Like, this is just the experiences and the reading that I've done, that I've come across. But by no means am I an expert at asking questions. But it's not something that you can just wake up and do. It's not like you can't just wake up and run a marathon without training. You have to kind of develop the skill of asking questions. And then it's about asking questions at the right time, or what type of question to ask. So I think first of all, it starts off where you create an environment where curiosity and questioning is welcome and it's rewarded. In a lecture, maybe not so much for me, because I'm not the person who's going to put my hand up in front of 300 people. Well, you might be, but I don't know. But that's something I need to work on. You know, even though there are so many people, I need to make sure that I still get what I want, if you know what I mean. So you need to create that environment where it's welcomed. And even if there aren't many people, maybe if the lecturer is more inviting towards saying that, okay, no question is a stupid question or something, just making me feel a little bit more comfortable. But it's also about coming out of your comfort zone to get what you want, because you're not going to be comfortable everywhere. So for me, maybe it's about coming out of my comfort zone in a lecture full of 300 people to ask a question. But I'm more comfortable in a seminar. So that's kind of like a classroom. So you have around 30 people and I just ask any question. You know, the beginning of the year when I didn't know anyone, when I didn't know any other friends, you know, I didn't really say much. But now that it's been 2 years, we've literally had the same group for the little seminar group. So I've become more comfortable with asking questions. But another way that you can, like, after that, so after you've got your environment, and even if it's not like encouraging yourself to come out of that environment to ask that question, become a keen observer. Ask everything of what you see, what you hear, what you experience. Don't like assume it. Don't assume it's obvious. Just keep asking about it, about something that you hear, like, oh, did this really happen? How did it happen? Why did it happen? Did it happen through this way or through that way? And don't assume it. And don't assume that it's also obvious, because it's not. I mean, to like someone who's like, I've just learned about, was it coronary heart disease or something? So to me, it's so obvious that a fatty plaque causes heart disease and so on. But to like a banker or to someone else, it's not going to be that obvious. Likewise, how inflation and bitcoins work, I have no idea. I have no idea. Like, that is something that's not obvious to me, but to someone who trades in cryptocurrency, that can be so obvious to them. So you really have to assume that nothing is obvious to anyone, because we all have different backgrounds, different types of learning and experiences. So don't be like, I'm not going to ask this question because it's so obvious. You know, look at the world with like, you know, a fresh pair of eyes and question everything that's familiar or that you might think is familiar. And like we talked about before, like, you have to know the power of asking questions, and not only asking questions, but asking different types of questions, like open-ended, closed, or leading, and know when to use them. So my example was about, you know, doctors or clinicians using them when talking to patients. But you can think of, I don't know if you guys can think of any other examples of when you would use those type of questions, or in an interview. In an interview, you could ask those questions. But And my last tip is like, just keep asking why. Like, just keep asking why until you can't. That's what my secondary teacher, my secondary physics teacher told me in year 8. He was like, just keep asking why and until you can't. And then when you're satisfied with your answer, then go away. But that, it sounds annoying, like a little child just like, why? But it's just a way to learn more. I mean, and yeah, like just keep asking why. I think that's my number one tip. I think start with that, and because it's even like a small question like why, it stimulates people to it provokes a good answer from someone or from something, and it learns you to explore and learn, and I don't know, it has like, it shifts the way that you think of things or how you perceive things. So I think in that way, questioning is really good. I think I've just like blabbered on so much about it, but I think especially like if there are any high school students watching, like in high school, I think is the best place to kind of start refining that skill, because it's when, you know, you're developing the most and learning the most. And it's a good way to start your basis of knowledge for anything. And you might not be able to do that because of the way that like teaching has gone now, of, you know, the whole rote learning and thing, but try to break out of that. Don't just try to break out of that and just ask questions when you think of it. Don't be like, oh, this is off topic, so I'm not going to ask it. Just ask. You know, what harm is it going to do? Just ask. But I was telling my flatmate that I was going to do this webinar on asking questions, and she started talking about, you know, it's like not high school or studying or education way of asking questions, but religious. She was like, how a lot of people are like have a lot of blind faith because they don't ask questions back, and it causes ignorance because they just accept what they're told. They don't question it back, and because of that, they can fall into traps of you know, being ignorant and thereby hurting people or harming people just because of the ideals that they're told to follow. And I think like that's transfer that over to life. Like, don't accept everything you're told. Have a way of asking questions and a rhetoric that makes you think more and just gives you a deeper insight into things about life. But I think, I don't know how long I've been going for, but I don't know if any of you guys have any questions or anything you'd like to ask, and then we can go from there. Oh, 1 second. Yeah, I mean, if you guys want to ask any questions throughout, go ahead. So, sorry guys, my first time broadcasting on anything, and I'm just trying to figure out what's going on. Right. Okay, there's like a start bar, so. So to talk about questioning more, it also makes, I think, oops. Oh. So I've got a question from Mariam for my med school journey. So my med school journey so far, so it's only been 2 years, so it's not much of a journey compared to, I don't know, the other 5th years that you might have heard talk, or the graduates that you might have heard talk from previous webinars. But so far, because for me, from moving from London to Liverpool, you know, I've lived in London my whole year, so like 18 years, and then I suddenly moved to Liverpool. So for me, it was like a stark change, and it's something I had to get used to before I even thought about medical school or something like that. So that's one thing that I found difficult. And then when you come to medical school itself, it's true what they say about the workload. It's like it's a lot. It's a lot that you have to do. But then when you think about it, when you think about the responsibilities that you're going to have when you are a doctor, it makes sense. Like you might think that right now in first year or in second year, that, oh my God, I've got so much to learn. I've got so many seminars to do, so many assignments to do. But then when you think about the responsibility of you being responsible for someone's life and earning that trust from someone, someone could just, a patient can come and tell you their whole life story. And it's nothing compared to that type of responsibility you're going to have. So I think that's what keeps me going through med school. So the A-levels that I did were biology, chemistry, physics, and maths. And when I did A-levels, you could drop it and still get like the AS level certificate for it. I'm not sure if it's the same for you guys, but so I dropped physics after because I just didn't want to handle 4 A-levels at the same time. I thought 3 was enough, and it was good that I did that because I feel like I would have struggled a lot with 4, and especially physics. But I loved physics, but I knew I was trying to be smart, and I knew that I couldn't get like 4 A's and everything, so I kind of dropped that. I think even like when I was trying to think about my A-levels and what I wanted to do and what I didn't want to do, I talked to my physics teacher and I was like, okay, I've got this interest for physics, but I don't know if I can do it. And he was like, okay, if you're applying for medicine, be smart about it. Like, you need to get 3 good grades, so you don't always need 4. But then he was like, if you still want to do physics, if you can still read about it, you can still learn about it. There's nothing stopping you from doing that. So yeah, I think that's one thing that you might have to consider when you do pick your A-levels. Pick something that you're interested in, but for medicine, pick something that you know you're going to be good at and that you know that you can get a good grade out of. So thanks for that question, Mariam. So I think Olivia's asked how much patient contact I've had so far. So in Liverpool, we start placements in second year. So that's all about going to hospital. So we've started going to hospital, but we only do 1 week rotations. So we do 4 weeks of lectures and then a week of hospital placement, then 4 weeks of lectures in a week. And we carry on like that. So I've actually finished my 4th block of the module that I'm doing right now in lectures. So I'm going to start my 5th clinical rotation next week. But when we go into hospitals, it's much more than I thought we would actually be able to do. We can't take bloods yet because of some insurance policy thing, but we're going to start that from 3rd year. So bloods, cannulas and stuff. But as second years, we talk to a lot of patients, talk about their histories, what brought them into hospital. We relay that information onto the doctor that's looking after them. We shadow doctors. We can go into surgeries and look at some cool procedures and operations, which is quite cool. But we have a lot of patient contact. It's literally that whole week. It's just talking to as many patients as you can, doing examinations on patients. But yeah, and everyone in Liverpool is so nice. I mean, they kind of really want to talk to you. Like, I thought they just say no to medical students. Like, they don't want to bother. Like, you feel like you're bothering them. So I just thought they'd say no, but they're so nice. And most of them are quite elderly and they just love talking to you. And they literally talk to you for like half an hour or an hour. And it does go off topic sometimes, but it's just nice to talk to a patient. And yeah, I think that type of conversation is quite good. And I know in some universities that patient contact doesn't start till quite later. So when you do pick your universities, have a look at that, because for me, patient contact is something that's very important. It's the way I learn, by learning how what we've learned in lectures is applied to placements. So I think for me, that was a very huge deciding factor to come to Liverpool. And in second year we do it, but then in 3rd year we have like 3 weeks of placements and 2 weeks of clinical rotation. So as you progress through the year, you get more and more patient contact to like 5th year, where you're literally in hospital the whole time. And also we get like little shifts in A&E. So the acute medical unit shifts, but we have them during the night. So we have it from like 7 to 10 or like 9 to 11 to actually learn what it's like as a night shift as well. And I honestly thought that would start in like 4th year or something, but it starts pretty early on. So it starts in 2nd year. So I think that's really good. But thanks for that question again, Olivia. Another question. So I don't know how to do my question thing, so I'm just looking at something else. What grade? Okay, so what grade I got in chemistry? I think I got an A in chemistry. I got an A in chemistry, an A star in biology, and an what was it? A star chemistry and an A in maths. And when I actually my AS levels weren't that great. It wasn't that great. I think I got an A and 3 Bs. It was honestly like it just hit me out of nowhere. Like I thought I did well, but obviously not good enough. And I had so many questions about like, should I even continue doing medicine? I had a lot of teachers that told me that you can't do medicine with an A and 3 Bs at AS. And like it honestly just like startled me. Like that day, I remember like I can literally replay every single thing that happened, and I honestly thought that I wouldn't get into medicine. But I knew that it's something that I definitely wanted to do. And I knew that if I didn't try, I'd be very disappointed with myself. So I tried and I got in. But people would tell you that you won't get in or something like that. But if it's something that you want to do, you will eventually get into medicine. So even if you do get a bad grade in something, just research and find out how else you can do it. You might not be able to do it straight after school, but you can always do it after you do another degree, or if you take another path, or if you do an access course. You know, there's a lot of ways to get into medicine, a lot of non-traditional ways to get into medicine. So if that's something that you really, really know that you want to do, always just do some research and find out. So another question. So Mariam was asked what work experience I did before I applied to medicine. Okay, so I did a work experience wise. Okay, so first of all, I tried to secure my clinical placement. So that's any placement in a hospital or healthcare environment. So I did like the usual like 2 weeks of shadowing a doctor or a consultant in a hospital. So I did that at UCLH, and for a week I was in surgery, on the surgery ward, and for a week I was on the labor ward. And that was very interesting and very eye-opening. And honestly, when I told my parents that I saw like a baby being born, they didn't believe it. But I was like, yeah, that's what kind of happened when I was on the labor ward. So I had so many good experiences from that. But again, it was only 2 weeks and it was just shadowing. So I kind of wanted more. So then I applied for a position volunteering to the Barts Hospital. So, you know, the Queen Mary one in London. So that was the Royal London Hospital. And I volunteered to be a patient care position. So no, it was a patient journey. It's called a patient journey. So what I do is just talk to patients, you know, offer them tea and coffee, but it's mostly just talking. There's nothing clinical about it, but you're in a hospital. And in that way, I got to talk to so many different patients and there's so many nice people. But I also worked on the A&E ward, so it was a bit busy at times. But I did it once a week for 2 hours every Tuesday after school for one and a half years. And I think that's the best experience I've had so far. Honestly, like I literally did nothing clinical. I didn't go to a surgery or anything, but it was just like walking the halls of an A&E ward, talking to patients. But it was in the daytime, so it was not as crazy as you might think, you know, because in the nighttime it gets really crazy. But it was during the daytime. So when I say daytime, it's like around 4 to 6ish. So yeah, so that was really good. But I did kind of use like the opportunity, and I asked the doctor if, you know, I can follow you around for a little bit or go to the recess place. And they had an air ambulance at Royal London, I think. So they brought a lot of patients in from there, and that was quite exciting. Not for the patient, but it was quite exciting to watch and to just know like the procedure of what happens next. And yeah, I think that was it for me, the work experience that I did. And that really helped me like confirm that medicine was what I wanted to do. And to be honest, like work experience is the number one factor, I think, for a lot of my friends that I've talked to about that helped them determine that medicine is what they wanted to do, because you literally like firsthand look at what you're going to be doing in the future and whether you like it, whether you don't like it. And to be honest, I had a lot of doctors at my placement tell me that if you want to do medicine, don't do it, which is a bit counterintuitive, but I think because they try to tell you that it's a long process. You don't stop. You do it forever. So if you're not ready for that type of commitment, then don't do it. But yeah, and that was my clinical side of work experience. But other work experience that I did, I didn't actually volunteer at like a care home or anything, but I did do teaching at a teaching centre, and also did some private tuition teaching as well. I did a lot. I don't remember actually. Sorry, but yeah. And I remember I didn't work at because the whole working at the London hospital thing was a voluntary kind of work experience. So then, and it was like caring for the community. So then I didn't do the care home work experience. That a lot of that's quite popular. A lot of people do today, and it's quite easy to get as well. So if you are looking for work experience, look for the care home, like the option, or working at a special needs unit or something, because it's quite easy to get because they don't get a lot of people to help out. But just make sure that some places have like age restriction, and you'll be fine. But yeah, I think that's all the questions so far. But if you do have any questions, you keep them coming. So just while we wait for some questions, just talk about, you know, the asking questions, what I was talking about earlier. I don't know, what are your views on that? What do you think is happening in your schools? Do you think the same thing is happening, or do you think that you're kind of coming away from that rote learning and learning to ask questions more? I don't know, what do you guys think? What's your opinion on that? But I think sometimes people tell you that there are no stupid questions there are no stupid questions, or there are no bad questions, but there's always like a time and place to ask a certain question. And yeah, there's like a time and place to ask a question and what type of question you want to ask. So yeah, you might not always have a stupid question or a bad question, but if you ask the right question, you can elicit or obtain the most information that you can out of something. So I think, again, yeah, like it's the quality of the question that you ask. But question always makes it kind of makes like new patterns in your brain, because if you're like a rote learner, you just believe what you say. Like you're told something, you believe it, you carry on. But then if you ask questions, you kind of create this new like flow in your brain of like, you get asked something, then you question why, and then it kind of branches off into like, okay, why did this happen? Why did that happen? And you kind of go back, and then it's like this whole map in your brain. So I think, yeah, so I think like questioning also like forms new patterns in your brain, and the more patterns it forms, the more flexible you are. And obviously the more flexible you are, the more information that you can kind of store in your brain and more you can ask. So asking questions and learning that type of skill of not accepting what you're told kind of makes you a smarter person. It makes you wiser and it makes you more open. So I think that's another benefit of questioning or something. So we've got another question. So that's from Mariam again. So how many hours you study a week? Okay, this varies, but mostly, so my school timetable, my university timetable, is literally like 9 to 5. We literally have like 3-4 lectures a day. So it doesn't vary that much from high school, which you kind of think like you'll get used to. But then when you have friends saying like, oh, they're only in uni for like 3-4 hours a week, you're like, oh. But we're literally in like 4 hours a day. So, you know, to go over the lectures and stuff already after university, it's quite long. And I tried this in first year, like it changes all the time as well, because you realize that you're not that type of learner. So then you just keep changing. Like in the beginning, I just literally went through lectures, like just lectures and lecture notes and stuff. And then I realized like that's not how I learn. And it took me a long time. It took me like an extra, 4 hours a day. And then I realized like a month, like when we had our next test, I realized that's not the way I learn. So then I changed it when I was like, okay, like studying for like extra 3 hours a day is not making a difference to me and I'm just wasting my time. So then I kind of figured out how I learn. And I think that massively decreased my time. Because again, like that old saying, like it's quality, not quantity. You need to know how you study best, and then your timing will revolve around that. If you're a person who writes out everything in order to learn, yeah, you learn, but it might take you a longer time. But I think there's like studies that shown that like constant revision blocks of like more than 2 hours is useless anyways, because it's like your attention span kind of like is only for a short amount of time. So you stop like paying attention and you just write. So you need to also give yourself breaks as well. But for me personally, I think now I revise on top of university, whereas maybe an hour or 2 a day. But then it varies, because if you know I'm ill or if I've got something on one day, I just shift it to like the weekend. But then because I live in London, I have to go all the way. I go back home sometimes, so and I can't study at home, so I don't revise for the weekend. So it's all about timetabling and managing. There isn't like a certain number of hours that you have to work a day. And I think you need that skill of like managing your time as well. And when you come to university, you're going to be using that skill way more. And with revision, it kind of works the same. You need to put it around, and you need to make sure that it doesn't like control your life. I know friends that are like in the library the whole time, and I'm like, why? Like, they don't do anything else. They forget that they're at university and that they're like 19, 20 years old, and they're just sitting in the library, like studying for 5 hours when you could, go out and have dinner or watch a movie or something. And to be fair, like sometimes, yeah, I don't even know if they get better grades, but like they are more confident. But it's just like, it really depends on the way you learn. And I think the sooner you figure that out, the sooner like you will be able to manage your time. I think that's what I would do. Yeah. Thank you for that question, Mariam. Yeah, guys, keep your questions coming. Yeah, even if it's not related to the talk, please ask any questions about medicine, about how I got into medicine, any tips that you would like. Just keep asking anything. So I think right now you might think that in high school, like the asking questions may not be relevant, but honestly, like you can ask it anywhere. And even in life, when you just talk to like your friends or your families about any topics, or when you have like, every like once in a while you have like a philosophical talk with someone, I don't know, just use that skill then and just keep asking like more questions, because it's the only way you're going to learn. Like when you're told something, you don't, for me, like even when I learn medicine as well, I like group work a lot because I like asking questions and I like confirm, like it's a way to verify and confirm what I've learned, rather than just sitting in a library by myself, like writing out or reading lecture notes. If I just go to my question, I'm like, oh yeah, so how does that do that? Or why do you do that? And then they reply with something, and then I ask them a question back. Or if they ask me a question, for me, it's a study tool. I use it for my benefit, and I use it as a study tool to learn. And I found that group work for me is like the way to learn. So again, if you relate it back to that question of how many hours a day I spend, it's more like how many, like I put it over like a week, and when I can meet up with my friends and we kind of like study together. But obviously I do have my independent study, but it's just to like confirm and reiterate my learning. So that's why I have my group work. But yeah, and also guys, don't forget to subscribe to the Medic Mentor YouTube channel. It's great, and we have so many webinars about so many different things, especially about medicine. And there were so many great webinar talks about medicine interview tips and women in medicine, and they're great. So make sure you subscribe and keep on watching these webinars. So I think, yeah, I'll just stay live for like a couple more minutes just for you guys to ask any more questions that you might have. But if not, I'll just blabber on about questions. I also think so. I think just to like go over what we've talked about, the art and the skill of asking questions has like died out. And I think we need to bring it back up. And to bring it back up, first we'll talk about the importance of asking questions. Say that it's important, it's powerful, and it's vital to like the basis of learning whatever you're thinking about: medicine, science, business, arts, even talking about religion, which is what I mentioned earlier when I was talking about my friend. It's all on the basis of asking questions. And again, it's not something that you're just going to like suddenly learn how to do. It's a skill that you have to refine, and you can only do that by practicing. And you have to practice to ask questions. It sounds so like simple, like, oh, just ask a question, like, but you have to know when to ask the right question and how to ask the right question to get the best information you want. And just know, like, if there's one thing you're going to take away from this seminar, just take away that webinar, that it's important, and it will eventually lead to like a breakthrough. Even if it doesn't go like that far, it will make you understand even a small thing better, and it will create new like patterns in your brain and make you a flexible learner. So I think this webinar was all about how you can become a better learner. I think and you can do so. It's so simple, not by spending hours in the library or reading, doing so much extra reading or doing so much research, but it's literally starts on the basic fact of asking a question. And I think that's what my webinar was about. And by no means I said it as well, like, I'm not an expert on this. I'm not like, the professor of asking questions, but it's just something that I've come across and something that I've realized myself and that I'm trying to change and trying to do just to make, just to become a little more wiser and a little more open to concepts around the world. But yeah, so I think that's it from me. Keep on watching these webinars and subscribe to the Medic Mentor channel. So I'll see you guys soon, hopefully, and enjoy the rest of your day.